Hello, and welcome to this presentation of a formative evaluation of the Community Clinic of Northwest Arkansas's Tuberculosis Awareness Screening Program. My name is Candace Hingston, and thank you for watching. Research has shown that the development of culturally competent, sustainable screening programs in migrant populations have been highly successful in reducing heavy disease burdens. For Marshallese residents in Northwest Arkansas, the impact of tuberculosis on health outcomes of individuals and families has been a major concern for years. The Tuberculosis Awareness Screening Program, or TASP, which is facilitated by the Community Clinic of Northwest Arkansas and funded by the Arkansas Department of Health, is the first of its kind in the area to be dedicated to the migrant population of Marshallese residents. In the development stages, the two agencies plan to begin implementation in 2019 at all community clinic locations. In addition, a partnership with the Bates Outreach Clinic, an affiliate of the Department of Health, is being established to accept referrals from the community clinic to provide treatment for positive patients. Based on conversations with the TASP program administrator, 3 program objectives were identified to assure that the TASP formative evaluation outlined program goals and current practices. The first objective was to address the extent of need for TASP in the Northwest Arkansas Marshallese population based on the disease burden and community resources. The second objective was to evaluate the appropriateness of cultural competence and health literacy in the TASP design. And the third objective was to evaluate the feasibility of the TASP implementation in regards to partnerships with other healthcare organizations and applied resources. The program's theory of cause and effect, theory of implementation are shown here in the logic model for TASP. As you can see, the logic model begins with the program goals established by the community clinic and the Department of Health. To accomplish these goals, inputs have been identified to establish program resources such as research for needs assessments and the identification of community assets and partnerships. Outputs include activities performed by the community clinic to make the program implementation successful, like engaging the identified community partnerships to increase resources and developing surveillance methods, which are actionable forms of investment. These include short-term changes such as bringing awareness to the program for screenings in the Marshallese population, to intermediate like expanding partnerships to other impactful organizations, and finally long-term changes or outcomes like decreasing the incidence and prevalence of TB in the Marshallese and general population. The purpose of this formative evaluation is to provide an assessment that identifies task strengths and limitations in the development and implementation processes. This will aid in improving design and impact on the targeted population in Northwest Arkansas. Additionally, recommendations have been developed for creating sustainable community-based prevention and intervention methods. Relevant stakeholders have been identified, including the community clinic, the Department of Health, the Bates Outreach Clinic, and the State of Arkansas Office of Management and Budget. Program questions that developed the evaluation were based on the relevance of the program for the Marshallese and migrant population and barriers to implementation from similar established programs. As you can see here, they align with the program objectives. Methods for answering evaluation questions in this formative evaluation are based on the Springdale, Arkansas location, which provided care to the largest population of Marshallese in the area. Administration with working knowledge of TASP were given the opportunity to complete the administrative survey, as it was the only inclusion criteria for data collection. A sample of 5 administrators participated in the survey and provided open-ended responses to each question. Additionally, interviews were conducted with each administrator from participating agencies. The administrative survey was a confidential and voluntary tool to collect respondent opinions on the Marshallese population. Answers were uploaded to Atlas TI for qualitative analysis, where an open network was created to analyze patterns and responses. The program administrator questions were open-ended and used to assess the feasibility of TASP implementation. Interviews with other agency administrators were informal and provided information on the role of the government entity in the program's development. Thematic analysis was used in Atlas TI with open coding and link coding to develop themes. 5 essential themes for program function were identified. You can see the themes and breakdown in this network graphic, including effective outreach methods, cultural characteristics of the population, educational necessity, program implementation fundamentals, and community collaboration. Administrative surveys provided additional information on challenges of reaching Marshallese residents. Interviews with the program administrator and Department of Health affiliates revealed the expected function of the program and provided necessary evidence for sustainable results. The focus of each theme is listed here and includes the expressed concern for the high priority need of TASP and its potential for significant community impact. Barriers including TB stigma, cultural belief systems, and health literacy, language limitations, the vital need for educational component to be added to accommodate patient needs, data sharing, funding allocations, and referrals for program implementation, and collaborations to enhance TASP and the expansion of the program to the general population to promote community health. To highlight care quality, diversity, and access to care that TASP hopes to achieve, increasing health literacy and developing an understanding of health care in the targeted population is necessary. This will provide a basis for the creation of services that are sensitive to the needs of the population, yet provide education to promote a sense of self-efficacy and responsibility to improve health outcomes. The implementation of a program like TASP, which is addressing the needs of a migrant population, is indicative of a certain level of cultural competence on part of these agencies. However, groundwork is necessary to improve inputs and outputs. With functional aspects of TASP being aligned with program goals and the strong support of partnering agencies, the outlook for the program's sustainability is positive. The logic model for achievable outcomes is attainable with continuous improvements and activities, including the addition of an educational output for the realization of both short and long-term outcomes. Therefore, the first recommendation is the development of community workshops that occur monthly to educate potential Marshallese screening patients, reduce stigma, and foster collaborations with new stakeholders. Next is the development of individualized health education strategies. This would function as a post-screening health education for patients to aid in understanding their diagnosis, the treatment plan if needed, and counseling concerns associated with the diagnosis. And finally, the requirement for staff to participate in cultural awareness training to enhance their knowledge of Marshallese beliefs and barriers to program implementation, introduce them to effective methods of outreach, and address concerns of confidentiality, ethical practices, and individual biases, which will prepare them for patient interactions and program planning. I appreciate your time. For more information, please contact me.